This is Dr. Janani, ENT and Facial Plastics. Today we have with us a patient who's planned for fillers. Fillers not entire face, mainly mala festoons and her nasolabial fold. The trick about mala festune is it should be done only superficially because there is the risk of nerve injury, so which we have to keep in mind. So usually we prefer injecting over the zygomatic arch. In that sense, when we inject over the zygomatic arch, it would be a deeper filler. So we lift the mala festune from deeper within. So if we are injecting very superficially, it is risky. So you build material below the festoon to make it a little bit prominent, to make it a little bit like evident. It becomes a smooth line then. So the dip that is causing the mala festoon then becomes a even line. So that is how festoons are camouflaged. So when we are building mala festoon, the fillers in the zygomatic area, we go with high G prime fillers. G prime is nothing but rheological property that is related to the innate nature of a filler, like how dense it is. And with respect to the nasolabial fold, again we have the major artery, the facial artery, which we have to bear in mind before injecting. So again, nasolabial fold, we do a cross hatching technique. We don't inject along the lines. We do a cross hatching technique that has to be done throughout the nasolabial line. So we'll go with the first. We'll prepare by applying the thick coat of numbing cream, and then we'll proceed. So ideally fillers are used mainly to camouflage the hollowness, and in case of prominent lines like static wrinkles, for example, we use it to camouflage it. So fillers are mainly two types, high G prime fillers and low G prime fillers. This G prime refers to the rheological property, which is the innate density of a filler. It describes the density of a filler. For example, in areas like nasolabial fold or building the zygoma, we need high G prime fillers to build the area. For example, mala festoons, which is nothing but the natural lines which are present in most of the South Asian population, Indians mostly for that matter. We have, all of us have mala festoons. So to camouflage the mala festoons or to build a little bit of cheek prominence, or to camouflage the temporal hollowness that happens with age, or the nasolabial fold. So these are the areas where we use the high G prime fillers. Low G prime fillers are those which are used over the lips. So these are like can be moldable. It is soft, and lips being a very soft area, it's a very sensitive area. We use low G prime fillers. So today we have with us a patient who's planned for a mala festoons, the lines over the cheeks, right? So that fillers, and as well as nasolabial camouflaging fillers. She also has a static wrinkle over the forehead. That also we are planning to do little bit fillers and mostly with the Botox. So basically the forehead lines and the glabellar frown lines, the crow's feet, these are the places where you can go for Botox. And fillers are used to build volume. So these can be used in temporal hollowing, the nasolabial fold, to give a sharper jawline, and to increase the plumpiness, or lip fillers can be done. So the most commonly asked question is, what is the difference between Botox and fillers? So Botox is basically a neurotoxin. It is botulinum toxin. It is used to paralyze the muscle, whereas fillers is used to develop or increase the volume of a muscle. In the sense, if we have a wrinkle, especially in the forehead and all, these are dynamic wrinkles. When you're smiling or when you're frowning, the wrinkles appear. So when you're targeting the wrinkles, which are a dynamic thing, which appears when you're emoting or animating, then we go with Botox. Fillers can also be used for wrinkles, but these are mostly used when there's a static wrinkle. For example, when you're even with a blank expression, or like blank state, you will have the wrinkles, poker face also, the wrinkles will be seen. So this would be the difference between and Botox are mainly used for wrinkles only, whereas fillers can be used wherever there's a volume loss. For example, when there is a temporal hollowing, or when the nasolabial fold is prominent. With age, these are the age related changes, and when there is with age there is prominent jowl, when there is jowl drop, you can use fillers to build the muscle volume above and below it, to make it a smooth appearance. So this would be the difference between a Botox and fillers. So find whether what suits you, a Botox or a filler, and get your consult accordingly and plan. Thank you.
take time also, depend upon person's metabolism also.
Okay.
Sometimes it is taking 1 week also. Okay, so don't
Okay.
worry about that. Till 1 week you are not seeing any results. Okay,
Yeah.
till 1 week it will be there. Like Botox is starting after 3 to 4 days. Okay,
Oh.
and might be possibility after 1 week also. Okay, so no need to worry, but don't massage over this area, don't pressure over that area.
Okay.
Today you have to just wash your face just with normal water. Don't like rub that area. Okay, avoid any hot food is there or anything, just cold is okay, normal cold. Okay,
Okay.
and else you can do over this area also, that ice cubes are there that you can apply. That's it.
There, here.
Here also just normally you can put like this.
Okay.
That's it.
If
Over
you want.
under eye area you can little bit just in round
You can buy
motion.
ice gel pack, no? You can
Yeah,
just
yeah.
buy that and keep it on top of face.
Okay.
Instead of direct ice also, just gel pack directly on face. That is also okay.
So you are okay?
You're
Now,
okay?
you
You
can see the
happy?
result?
Yeah.
Anything you want to ask, you can ask to doctor.
No, nothing. It's okay.
Now you're 40 years old.